Hello, I am Renee Amstedt-Meyer, an associate professor at Baylor University in the Department of Public Health, an investigator for the Physical Activity Research Center, PARC, which is funded by the Robert Wood Johnson Foundation, and a committed researcher to advancing health equity through physical activity, especially for low-income, diverse, and rural communities. Much of the U.S. population does not engage in regular physical activity, especially adults. And many adults in the U.S. do not meet or even get close to meeting the recommendations for physical activity to advance health. Many rural Americans disproportionately experience lower health status and life expectancy attributed to obesity and other physical activity-related chronic diseases. Approximately 20% of American Indians live in federally defined rural areas and experience health disparities related to physical inactivity, including disproportionately high rates of chronic diseases like obesity, diabetes, cardiovascular disease, and stroke. We need to better understand what influences these health disparities to better understand how to best advance health equity in these communities. And even though evidence supports the role of perceived physical and social environmental factors as potential influencers of physical activity, we have few established tools to accurately measure these. The purpose of this collaborative project was to validate a previously established tool to measure perceived environmental supports for physical activity among rural adults. This previously established tool is called the Rural Active Living Perceived Environmental Support Scale, or RALPESS, for an easier way of saying it. The RALPESS was developed through support provided from the Robert Wood Johnson Foundation, as well as Active Living Research. The original RALPESS study, which was validated, supported a 33-item, 7-factor scale, suggesting the following sub-areas or subscales of this instrument, including indoor areas, outdoor areas, town center connectivity, town center resources, school grounds, church facilities, and then areas around the home or the neighborhood. And rural adults in the original validation study were not recruited from American Indian communities. So as I previously stated, that the purpose of this study, which we're very excited about being published in Rural Remote Health, was to examine the validity of the RALPESS among American Indian adults residing in rural communities, which were recruited from local events hosted by partners of Tribal Head Start programs in rural Oklahoma. Our final sample included 130 adults, and 89% of them self-identified as American Indian. Results from our confirmatory factor analysis that we conducted as part of this project support the structural validity of the RALPESS among American Indian adults living in rural communities, and also support the internal consistency of this scale and subscales. And our findings suggest that the RALPESS is a valid and reliable tool for measuring perceptions of environmental support for physical activity among rural Americans living in American Indian communities. Although we do recommend future work to confirm this in other American Indian communities around the U.S., since this was just one subsample. This tool should be used by practitioners, intervention planners, and implementers, and in evaluation and research to better understand the perceptions American Indians have of their environments as it pertains to physical activity. This information will allow us to better understand one important component of why physical activity levels are so low, and it can help us pinpoint community strengths to build upon through interventions and advocacy, and also misperceptions that need to be addressed through health education. The RALPESS tool and development information can be found at the Active Living Research website, so anybody can access it. Download it, use it. That's www.activelivingresearch.org, and it's under the Tools and Resources heading within that website. And we would just like to thank our community partners and the survey respondents who made this study possible and allowed us to learn alongside them and from their expertise. Please reach out to any one of us as co-authors if you have questions or ideas that you want to share. We look forward to hearing from you.